Hi, I'm Sandra. I'm going to be your nurse today. Can you tell me your name and your age, please?
Brittany, and I'm 24.
Okay, excellent. So you're in today for a head-to-toe assessment. I'm going to start by asking you some questions, and then we're going to move through the body systems. If at any time you have any questions, just let me know, okay?
Okay.
All right, I'm going to be touching and listening in multiple spots. It doesn't mean that anything's wrong. It just means that we're being thorough. Do you know who the elected president of the United States is?
Joe Biden.
Okay, do you have access to 3 meals a day?
Yes.
Okay, when you walked in, I noticed that you're nice and clean. I don't see any problems with personal hygiene. Your posture is nice and straight. When you walked in, you had good gait. I didn't notice any assistive devices such as a cane or a wheelchair or walker. That's very good. Is English your primary language?
Yes.
Okay. As far as your mood goes, you're pretty happy?
Yes.
Okay, excellent, very good. Your BMI is pretty much equal to your height and weight. Okay, I'm gonna call a report on a 24-year-old female who came in today for a head-to-toe assessment. She started off by stating her age, which is 24. She was alert and oriented times 3. She had great nutritional status with access to 3 meals a day. Her BMI was appropriate for her height and weight. As she walked in, I noticed she had good mobility and good gait. No physical deformities or abnormalities, nor did she admit to any physical deformities or abnormalities. Her posture was upright and straight. She was in a good mood today, and she also states that she's normally in a good mood. Her primary language is English. She was nice and clean today. We started off with skin. I looked at her hair distribution, which was equal all around. The color was appropriate for her race. It was warm and dry to the touch. Her hands were nice and clean, nail beds clean. Her capillary refill was less than 2 seconds. Peripheral pulses, brachial pulses, and radial pulses were palpated. We moved up to her head. Her scalp was nice and clean, no infestations, redness, or dandruff or irritation. Her hair was black and clean. She denied tenderness upon palpation of her head. No lumps, bumps, or bruises noticed. We moved down to the face. Her face was nice and symmetrical. Cranial nerves 1 through 12 were intact. Temporal artery was palpated. No thrills were noted. She denies tenderness to the maxillary and frontal sinuses. Her neck was negative to pulsations, no lumps, bumps, or bruises. She denies tenderness to palpation to the trachea or neck. Lymph nodes palpated without tenderness, swelling, or enlargement. Carotid arteries were negative to thrills and tenderness when palpated 1 at a time. No lumps, bumps, or bruises to inspection. Auscultation was negative to murmurs and thrills bilaterally. Cranial nerve number 11, which is range of motion and muscle strength in the neck. She had full range of motion in the neck. We move down to the eyes. The external structures were clear without any irritation. The eyebrows, eyelashes, and eyelids. Conjunctiva was nice and pink. Pupillary reaction was equal and reacted to light and accommodation. The sclera was white. The cornea was brown. When assessed from the side, they was round and non-concave. We moved on to the ears. They were without any irritation or drainage. She denies any palpitation to tenderness. On the ears, the nose was midline with good patency bilaterally, no drainage. Mucosa was pink, septum was midline. We moved on to the lips. The lips were not dry or cracked, no irritation or lesions noted. Mucosa, teeth, tongue, gums, hard and soft palate, and the tonsils were moist without exudate. Thyroid was palpated, non-tender and not enlarged. We moved on to the lungs. Posterior inspection with AP to T diameter. Scapula and spine was midline. Anterior inspection with no use of accessory muscles. Respirations were even and unlabeled at 17. Lungs were clear to auscultation in all lobes, anterior and posterior. I also checked CVA tenderness, which was negative. No tenderness upon palpitation. Trach was nice and midline. She denies any tenderness upon palpitation. Heart sounds, sitting and lying, were auscultated with no murmur or thrills. S1, S2 noted. Heart rate was regular rate and rhythm. Also, the apical pulse was palpated at the fifth intercostal space on the left side at the mitral valve. Abdomen inspected at eye level with good contour. Nice and flat, color appropriate for race. No scars, striae, or visible peristalsis. Our pulsations were noted. The umbilicus was midline. Bowel sounds present times all four quadrants, tympany to percussion in all lobes, negative to tenderness with light and deep palpation through all lobes. We moved to lower extremities. They were nice and warm to touch. Good hair distribution, no edema or varicose veins upon inspection and palpitation. All peripheral pulses, femoral, popliteal, posterior tibial, and dorsalis pedis were palpated. For range of motion in the upper and lower extremities, no tenderness upon palpation. Good hand grip. Heel to shin test was negative. Patellar reflex was positive at 1+, and negative for scoliosis screen.